as you notice, we're a couple minutes behind schedule, so I'm glad to be live with you now, but because I was running late, I just realized I am matching the room that I'm talking in. I'm still wearing a t-shirt from earlier and I completely blend in. This is like Facebook Live camouflage. So one of the things that I wanted to talk about was our Saturday visit to Gloucester and get some ideas, because we only did half of our day and we want to come back out. I'd like to be able to bring Patrick and the kids. So if you had some thoughts that you could type into the chat of things that might be fun for me to bring the kids out, I would love to do that. And if you have questions that you could post in the chat, please do that. I am looking forward to answering some of those. Thanks, Michael. We're having salmon for dinner. So some of the things we did were going to Swedesboro. We started with a really warm reception and went and ate outdoors at the diner there, and that was fantastic. Greeted by lots of friends, and I was happy to see everybody. We handed out some t-shirts and some signs, and we're looking forward to doing more of that. We also had a good time being able to walk around and visit some small businesses, and that was really a lot of what I wanted to focus on this visit. But we will be coming back and looking to speak with some mental health and addiction service providers there as well. And so in our visits with some of the small business owners, it was really one of the more uplifting visits that I've had in talking to small business owners, because in this visit, I heard a lot of people tell me about how they've been able to adapt. And it was fantastic to hear how they'd made some successful moves towards online and being able to use platforms like the one we're using right now, Facebook Live and Instagram, to be able to talk about their products and then have people buy them online and ship them out instead of being in person. So it was great to see that and really hear those from Restored Antiquities and some of the other groups that are doing that. Just made me feel like there may be one sliver of positive that came out of this that's going to help people to pivot and really address a new group, a new market in a way that maybe they wouldn't have before. We know so many times as I'm going to different counties and talking, there's a lot of people who are still struggling and really haven't been able to transition in that way because either they didn't have the number of employees that they needed to qualify for those grants, or because of being a tourism industry, they weren't impacted in enough time to show what the impact was, because maybe seasonally it hadn't really kicked in. But in Gloucester, a lot of the business owners had told us some of the good news that they were having. But we also heard from some people who were really having a hard time. And despite adapting, the concerns that they had were ones that maybe had more broad implications. So in talking to the owner of a florist shop, it wasn't just the loss of customers coming into the shop, but it was all of those events that have been closed down, the not being able to have things like proms and weddings. And I know that was true when I had visited in Cumberland, the tuxedo shop there, but all those different vendors who typically come together and work around seasons, being able to provide for those big events. That's for this floral shop owner, 75% of their business is around events. And so being able to transition and move towards doing arrangements and home delivery and those types of things can be hard, but even harder when you can't get shipments in from other places and other countries with flowers. So right now they've been able to use flowers that are locally grown, and that's fantastic, but we know it's starting to get cooler, and that's going to be a challenge for them moving forward. So on a lot of fronts, they're getting hit, not only on the reduction in the number of events, but also in getting the inventory that they need. I heard a different kind of frustration from kind of the clothing stores that we visited that talked about how, like I just said, I'm in a t-shirt tonight. So many people are in Zoom comfortable clothing and really didn't for so long go out of the house. And so they didn't change up the wardrobe. They weren't investing in those pieces. And there was a whole season of inventory that shop owners had invested in. They lay out the money in advance of a season, and then to be able to have to transition into the next season after their store was closed and they didn't sell what they needed to for the spring, have to invest in summer clothing or fall clothing is going to be an outlay, an expense that they can't recoup. And that's very difficult. I can imagine that's so hard. And I'm glad that we're able to see that some people are starting to shop again, but not at the same level. And we know everybody's a little bit worried about the economy. So making that investment. One of the things that we also talked about, I think everyone kind of had September 11th on their mind and we're thinking about that. And I remember distinctly the president after that telling people to go back out and, shop and support those businesses. And, in the same way, I think one of the things that we all know we can do is to try and support local and do that wherever we can, because that's what we're all worried about is the identity that brings to our community. And if those restaurants and shops aren't there, what that would mean for our towns, for not just the climate that it brings to the town, the energy that it brings to the town, but also that needed tax base. So important that we continue to support. Looking at a few of the questions and comments that are on the side, and one of the things that we did talk about was vote by mail and how worried people are about the vote by mail. And my suggestion is we saw that in the primary, it was a historic turnout in vote by mail. So I felt really good about that. I think people have more time to fill out the ballot and fill out more of the ballot. What's always interesting to me is that so many people only will do the top of the ticket. And yet when they have the ballot in front of them, they can look into, do more research, talk to friends, and be able to explore the candidates that are down ballot that maybe they're less familiar with. So I'm hopeful that will allow people time to fill out their ballot, but also know that we want to return them in a timely manner, and that maybe you'll want to track your ballot online if you're planning to mail it back, or maybe you want to use a secure drop box because there will be at least 10 in every county. So that's what I'm planning to do. I want to be able to use one of those secure drop boxes and know that it's going to go directly to the county clerk from there. And then, of course, you still have the option for those people that just are wary, can go in person and fill out a paper ballot the day of. So there's a lot of choices, and we're going to do some, a hotline if you're having a hard time and you're worried, or you need to just make sure it's something about, just making sure you're using the right color ink and feeling like you didn't rip off that flap on the back. If there are questions like that we can help you, then happy to do it. But it's going to be a process that I think allows more people to vote comfortably. My mom had always worked the polling places. She loved doing it. My mom's really friendly and social. And so it was a fun thing for her to do. And she also felt like she was doing a service. But this year, she's just afraid to do that. There's too many risks for her health. So she's not going to be working the polls this year. And I think that's a challenge for a lot of other people. So if we can vote from home, then I'm glad to be able to do that. It's something I've done many times before, and I'm glad to. one of the other things that that somebody is asking, who am I? Oh, well, thanks for the question. So I'm Amy Kennedy, and I'm a former public school teacher. I'm running for Congress in the 2nd District, and I also advocate for mental health and more services for substance use disorders, and that they'll be covered. We know that that's a part of overall health and shouldn't be treated differently. I also have 5 kids. I live in Atlantic County. I've lived in Atlantic County my entire life. My family all lives here as well. And I am just answering questions if you have them about South Jersey and policies. If you want a little bit more information, you could take a look on my website where my issues are listed at amykennedyforcongress.com. And I am looking for some more questions that I can help with. So just give me 1 second. I'm going to read on the side several questions. Secure Dropbox. Oh, where the secure Dropbox boxes are. And let's see. Online learning. Oh my gosh, this is so great. Laurie, online learning. She says, I'm a mom of 3 young kids under 11, and learning online has been a struggle for many families. Now, you were a teacher and have 5 of your own kids. Do you have any tips for how to help our children make the most of their education during these strange times? Laurie, today was chaos around here. So we have 4 kids that are doing online learning right now, and it is in our kitchen and dining room and living room. So today I was sitting writing thank you notes at the dining room table. My son Owen was learning online a science lesson about nocturnal animals and sounds at night. And so there were the sounds of frogs and crickets, and that's going on. Harper was working on a Spanish lesson in the other room. Nellie, who's 4, is actually learning online too, and it was a music lesson that was supposed to be kind of some aerobic dance that went with it. So that was happening. And my suggestion is for you, good luck. I hope that some of your kids have headphones, and that we absolutely need to do everything that we can to make sure that our kids can return safely, because we all know how important it is for them to get back to the classroom. I saw people on the chat stream talking about wearing masks and doing our part. And we also know that we need to increase our access to broadband, because while my kids are all working from home and we have internet access that's fairly reliable here, I've watched, as I've seen different people who have had to go drive in their car to be able to get a signal on their phone, that their schools have tried to provide devices, but that doesn't always mean that they have internet service. So they're in maybe a public parking lot to be able to try and get service from there. And that there's so many students who require special ed services or have an IEP that haven't been able to interact in a way that really benefits them. So there's a whole lot of families struggling. And my suggestion is that we're all doing our part right now to get us back in the buildings as soon as possible. And that's going to happen with making sure that federal funding is available too. Some things like making sure that we have the proper PPE and ventilation for schools. It's something that 11 out of the 12 representatives from this state all supported in a letter. Unfortunately, my opponent did not sign on to that and the funding that schools need for that PPE for them to be able to return. And it's at a very high cost to our districts that have all tried to make sure that when they can return safely, they'll be able to. I know that our school in Brigantine made those investments in, everything from plexiglass barriers to masks and gloves and things that the school nurse would need as well to be able to set up a separate area for students who were showing symptoms. And that all comes out of the annual budget unless they have the funding that they need. I am going to take a look and see what else how would you advocate for mental health parity in order to better access treatment through insurance companies? Sydney, thank you for your question. I am really interested in seeing us expand healthcare broadly, but also making sure that when people have access to healthcare, that includes parity in mental health. So we know many times, although it is the federal law that was signed in by George W. Bush, that it's not always implemented. And so there's more onerous limits and also more expensive co-pays. We see this also in networks that people have phantom networks where maybe they are supposed to have mental health coverage, but they actually don't have any providers in their area. And we have to be able to make sure that people have what they need locally, that if they are struggling with substance use disorder and they're willing and ready to get help, that it's available to them. And that when they need mental health services, that they're culturally competent, that they're available, that people don't have to pay out of pocket. We need to get more people in network by making sure that we're reimbursing appropriately. And also that we've seen an increase in access to telemental health, and I'd like to see that be able to continue even after the virus. I think people are finding that effective, especially when they are looking for kind of specialized help that maybe isn't available locally. Let's see. Loved your husband in Congress. Love the bill that your husband introduced in Congress for mental health parity. Thank you, Bruce. Yeah, it's still his passion and work. You know, he's in recovery and really cares about it. And I think that it's something that's affecting even more families. Unfortunately now, during the virus, we've seen an increase in people dealing with depression, anxiety, stress, and substance use. We're seeing in our communities an increase in methamphetamines. While we know the opioid crisis has been very troubling for our area, we're also seeing an increase in other drugs. And so we have to make sure that we are addressing that. In Gloucester County in particular, you know, heroin overdoses are extremely high. I had the honor of being able to speak to the fireman convention today in Atlantic City. They came from all over the state, and we know that so many of our first responders are the ones that are responding to overdose, and what they need to have the training, but also the supplies that they need when they're responding. But at that point, we know we're, as you say in mental health America, you know, it's at stage 4. And we don't want to treat this crisis just at stage 4. We want to be able to address our concerns and have earlier interventions so that people don't struggle and possibly lose their life. Let's see. We're talking about healthcare. COVID showed that our healthcare doesn't work. I think that's fair. Win with Paula Jean. And she asked if I support Medicare for all. And I think, you know, Paula, this is, oh, sorry. I'm not sure. So I think it's really important that we are expanding access and expanding Medicare. We have to be able to get more people covered, especially as you mentioned, during COVID. We're seeing so many people that have lost their employment and their healthcare is tied to their employment, particularly when I'm at the the distributions that are organized by Unite 54, and they've talked about how many people have been out of work for so long that they're at risk of losing their health care benefits. And we also know that treatment for this virus shouldn't depend on whether or not you can afford that life-saving treatment, that we absolutely need to be able to treat people who are struggling with COVID-19, and that we also will need to be able to allow people to have access to the vaccinations for this, regardless of their ability to pay, because your neighbor's health impacts your own. And I am hoping at this moment, when we're so focused on the health of our country, that we're not going to just put the bottom line ahead of our health as a country, because I think it's so interrelated that for our economy to be able to get back up and running and be successful, we're going to keep seeing it stall unless we address healthcare as part of that. The costs of healthcare are really crippling our families. We know we need to be able to negotiate our prescription drug prices and continue to protect people with pre-existing conditions. Let's see. I wanted to just take one more minute to talk about my trip to my visit, and mention some of the friends that we saw that came out and supported. There's a lot of great comments and questions popping up that I can come back to, but specific to Gloucester, it was really great to be out there and to see so many people come out. We had a great group of people from NJEA that were supportive, and NJREA that came out as well, who have been doing a whole lot of volunteer work for the campaign on their own time, or we saw people volunteering for other campaigns as well, down ballot campaigns, through postcard drives, through letter writing, LTEs. So I just want to let the people that are watching know that if you have any interest in supporting me or other candidates that are on the ballot this year, that there's a way for everybody to get involved. And this is the most important election, as you all know. And so being able to see so many people giving their time and making phone calls, activating their friends to get people registered to vote, talking to independent voters. That's the biggest portion of our district, is 37% independent voters. So being able to reach them and really communicate why you are voting for a certain person makes such a difference, because I think it's personal. And it's also great to be able to have so many supporters who are willing to put out a yard sign, to tell a friend, maybe to share a link to an issue that you care about or a policy that really is meaningful to you. Social media, especially if it's something positive, because I know so much of what we see is hateful and negative online right now, and it's really about criticism and it's antagonistic. So when you're able to share something positive, I think that really is meaningful to people. It's refreshing, and we have enough that we're all thinking about that can be discouraging. So if you're able to put out something about why you like someone, why you're in support of them, that's fantastic. And I hope you'll do that. We are going to be continuing to come out. I know I mentioned, maybe I did mention that we're going to definitely be in Gloucester again October 8th, but we're going to look for some other dates to come out that way. And also would love to get some more suggestions on things that we could look at when it comes to infrastructure needs in Gloucester County. I talked about broadband. We know that transportation is always key, but if there's specific things that you think we should take a look at that are in need, we'd love to talk about that and be able to focus on how that can be another opportunity for good paying jobs in our area, and to rebuild our economy. That Build Back Better slogan is something that I think really is important for South Jersey, but being able to bring our federal dollars back is key. We know that we have been hit with the SALT, and we want to be able to bring back some of the federal dollars. People are struggling right now. They're paying a lot in taxes, and we want to be able to get those as a return on our investment in projects that will really make a difference. Yep. I lost everyone for a minute. That wasn't how I was trying to sign off. I was just saying we had reliable internet service, but maybe not as reliable as I thought. Thanks so much for tuning in, and we'll continue to keep connecting. I think it's important to be able to reach out, and I hope to be able to meet you and talk with you in person. So much of what we do is really on the listening side, because it's not just about my feelings and my beliefs on an issue. It's about hearing from you what's important to you, and I'd like to be able to do that and get your perspective, because I think this seat is really about representing the people of South Jersey, not just putting forward my own thoughts. Thanks again, and take care, and I'll look forward to meeting you soon.